Has Alkermes begun to get its groove back? Sure seems like that way. The company specializes in developing drug delivery technology, as well as proprietary medications that combat mental illness, addiction, diabetes, multiple sclerosis. And for ages, it seemed as though Alkermes could do no wrong. You know, we've loved it for pretty much ever. Stock rising steadily year after year after year, including a terrific 35% gain in 2015. Then in 2016, it seemed like the wheels came off. The stock plunged from $79 at the end of December down to $29 in its mid-February lows. Unbelievably massive decline. Some of that was because Alkermes announced that its much-hoped-for depression drug had failed to meet the primary endpoints in not one but two initial phase 3 clinical trials. Some of it was simply because it got caught in the brutal market-wide sell-off, particularly in pharma. Since then, though, Alkermes has come roaring back, rallying more than 75% from its February lows, climbing back up to $51 as of today. What's driven the rebound? The company recently launched a new antipsychotic drug, Aristata, which is a long-acting version of Abilify. Makes it easier for people with schizophrenia or bipolar disorders to stay on their meds. And so Aristata has been quite successful. Same time, we've seen impressive growth in Vivitrol. We've talked about this before. Alkermes' once-monthly injection that helps prevent recovering alcoholics and opioid addicts from relapsing. Hey, speaking of Vivitrol, President Obama just signed the Comprehensive Addiction and Recovery Act, called CARA, which could dramatically expand the addressable market for Vivitrol, making it available at roughly 6,700 rehab centers that previously didn't offer this drug. Meanwhile, the company has some intriguing products in its pipeline, including a depression drug that flamed out in January. But it's trying to get back on track after presenting some data of a couple of encouraging studies early last month. Alkermes reports in a couple of days. Can't talk specifics about the quarter. I still think it's worth checking in with Richard Pops. He's the chairman and CEO of Alkermes. Get a sense of the company's longer-term prospects in the pipeline. Mr. Pops, welcome back to Mad Money.
All
right, Richard. We missed. There was a tough period for the company. But first, I want to just talk about this opioid situation, because as long as you have been on the show, you have told us that this crisis was coming the whole time.
That's right.
It's happened. What can be done?
Well, you know, it's gratifying in one sense and it's horrifying in the other sense. This epidemic is not going away in the country. In fact, it's getting worse. And prescription opioids leading to the use of heroin, and the number of heroin deaths and the fact that it's affecting and ravaging communities across America is now self-evident. And what's so important about this Comprehensive Addiction Recovery Act bill that you mentioned that the president just signed is that it shows for the first time the country actually mobilizing to do something about this.
So it's been somewhat out of the news. Is it because the numbers are horrendous, but it's just that people don't aggregate it? I want you to give our viewers a sense of how many and what Vivitrol could do.
So right now, millions of people are addicted to opioids.
Millions?
Millions. In the old days, 20 years ago, when you talked about opioid addiction, it meant about 300,000 people addicted to heroin in the inner city or someplace that nobody paid any attention to. Now, it's millions of people, and it goes all the way into affluent high schools in suburban America, through the inner city, through America. It's pervasive. So when you talk to governors and politicians of all types, when they hear from their communities, when they go to town halls, they hear about the opioid epidemic.
Okay, now we were concerned when I was putting together this segment. We don't want to give people the impression that necessarily that Vivitrol is going to be a huge drug for Alkermes, but theoretically, if all these different centers really did understand the what it can do, it could be a huge drug.
Well, you've been on this for years, Jim, and so have we. This is personal for us because Vivitrol was always considered to be a tiny drug for Alkermes, but it saves people's lives. And so we decided we were going to persevere because we knew the epidemic wasn't going to get better. And what's amazing, there's only 3 drugs to treat this disease in America. 2 of them are methadone and Suboxone, which maintain a physical dependence on the opioid. And then there's Vivitrol, which was a game changer because it blocks opioid receptors in the brain and it doesn't allow you to reestablish physical dependence on the opioid. So it's a whole new treatment approach. To change medicine takes time, and that's what we've been doing for the last several years.
Okay, I want to talk about another one where people don't understand the value of Aristata. People who take drugs for schizophrenia, after a couple months think they're better. They don't know. This changes that?
Well, what people don't realize who aren't around schizophrenia a lot is that it's a chronic, progressive, degenerative disease. So patients are often diagnosed in their early 20s. They'll go on medicines and then often stop taking the medicines for the reasons that you said, and the disease progresses. The power of the long-acting injectables, particularly one that's well tolerated, is that you can give an injection and you know that for a month or 6 weeks or 2 months that the patient is getting the right amount of medicine. And then a month later, 2 weeks or 6 weeks later, you go back, find them, get another injection. And it's the patient's choice, always of course. But often patients don't take their medicine not because they don't want to, it's because they have disorganized thinking because of their disease.
Okay, I think that we have to talk about the flame out that we mentioned earlier. A lot of people felt that when that drug didn't work, that was the end. That was never the case. Even when I went over all your releases, you did not say it was over. It's still on the go. Where are the trials?
So this is a drug we call 5461 for the treatment of depression. Depression is a disease that's treated primarily with the same type of molecule all the time, the SSRIs.
Right.
And many of them work, but millions of people don't get any response. This is based on a new mechanism of modulating different neurotransmitters in the brain, and we believe so deeply in the mechanism. The problem with depression studies is that placebo patients in those studies almost uniformly get better. You take people, enroll them in a clinical trial, pay them some money, see medical care, and they all start to get better. So distinction from placebo is the challenge.
Right.
And we're going to stick with it. Every depression drug that's ever been approved by the FDA has failed multiple depression studies. We just wanted to be smarter than that and avoid it,
Well,
but we're going to stick with it.
I just want to be sure, last question. You could have stopped everything, but you just believed, right? I mean, when you got those endpoints, you could have just said, listen, this is a dead end, but you really believed that this one's going to happen.
You've gotten to know us. We don't give up easily, do we?
No, you certainly don't. Okay, that's Richard Pops, Chairman and CEO of Alkermes. The stock's on the way back. Let's just hope that the government recognizes the value of Vivitrol and saves some lives. Stick with Cramer. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.